Welcome to Roadmap to Residency Evidence-Based Applications. And in this video is all about healthcare systems and access to healthcare. So whenever we talk about access of healthcare, we need to know about the different health disparities. So health disparities are population-specific differences in the presence of disease, health outcomes, or access to healthcare. Key is that there are differences between populations and measures of health. Example, access to care, health outcomes, and rates of chronic disease. So what are health disparities? So these are the persistent gaps between the health status of minorities and non-minorities in the United States. For example, African Americans, Hispanics, American Indians, and Alaska Natives, Asian Americans have higher rate of infant mortality rate, cardiovascular disease, diabetes, HIV infection, AIDS, cancer, and lower rates of immunizations and cancer screening. So what are the causes of health disparities? It may be due to inadequate access to care or substandard quality of care. So how do we solve these health disparity sort of problems? So the first step is to begin with long-term problems. For example, we need to rule out minority health issues, and we need to take in charge of system issues. It can be health status or health disparities, or the system issues could be lack of the systems approach or inadequate resources and support for systemic action. Then we address the contributing factors. So the contributing factors may be at an individual level, like knowledge, attitude, skills, practice, and the individual or community level, for example, physical environment, social environment, and economical barriers. And system level, for example, the components and resources for the health, enrollment, coordination, and collaboration, user-centered design, science, and knowledge. Now, after addressing contributing factors of health disparities, we move forward with support effective strategies and practices. So it can be again at an individual level, at an environmental level, and at a systems level. So at individual level, the effort is to increase the knowledge, to promote the attitudes to good health, to effort to build skills, to the efforts to promote healthy behaviors. At environmental level, the efforts to promote a healthy physical environment and a social healthy environment. Also at system level, the efforts are there to strengthen the components and resources, to promote the coordination and collaboration, and to foster leadership and commitment. After that, we go towards measuring the intermediate outcome and long-term impacts. So at individual level, for example, increased awareness, knowledge about disease prevention or risk reduction. Environmental community level, we go with decreased exposure to risk in the physical environment, increased public awareness about racial, ethnic health disparities, increased healthcare access, and appropriate utilization. So at system level, there is increased inputs and other resources for racial, ethnic, minority health or health disparities related priorities. After that, we achieve the long-term objectives and goal by increased quality and years of healthy life for racial ethnic minorities, reduced and ultimately eliminated racial ethnic health disparities, and systems approach to racial ethnic minority health improvement and health disparities reduction. So this is how we tackle the health disparity by first addressing the long-term problems, by contributing the factors, by by addressing the contributing factors, by developing strategies and practices, by assessing the outcomes and impacts, and then we have achieved the long-term objectives and goals. Now, moving towards the healthcare system. So there are different. So there are two basic models of healthcare system that we as a healthcare provider should know. There are many other different healthcare system models that is for the preventive and public health medicine or the economist. But where we need to know about the two main sorts of healthcare, two main models of healthcare system, which is according to the delivery methods and according to the funding method. So health system according to funding types is one that we all need to know by heart. So all healthcare systems occupy a distinct place on the public versus private continuum in terms of the financing and delivery of healthcare. Now, although distinctions blur, most systems tend to predominantly hold national health service model, entrepreneur model, or mandated insurance model. The main that we need to know is the private insurance model. The private insurance model is also known as a model of independent customer. Funding of the system is based on the premiums paid to private insurance companies, and in its pure form actually exists only in the USA. In this system, the funding is predominantly private with the exception of social care through Medicare and Medicaid. The great majority of providers in this model belong to the private sector. Thank you for watching. Keep studying hard.